Good morning and welcome back. Today we have Dr. Chantelle Martin, a resident physician at Piedmont Macon, joining us. Thank you for being here today.
Well, thank you for having me.
I am excited to have you here because today we are talking about the importance of getting screened for various types of cancers. And so I want to talk about it. What is early screening?
So early screening really means that we're trying to catch cancer at the very early stages because it's progressed to a point where treatment is difficult. So it's that first initial start of cancer that we're trying to pick up to make sure our chances of recovery and treatment are the best possible chances we can have.
And it is important to have that early detection. Now, which types of cancer screenings are the most common that you see?
So typically, and it's not really a one size fits all, but breast cancer, so mammogram screening, and that's really recommended for women over the age of 40. And this has actually been shown to reduce mortality related to breast cancer by about 25 to 30%. And then the next one would be colorectal cancer screening, which I'm actually really passionate about because the amazing thing is that, so it's men and women from the age of 45 and onwards that they are recommended to get screening. But the colonoscopy, not only is the physician going into the colon and taking a look, but they can actually remove any precancerous polyps or lesions at the same time.
That's
so it's
incredible.
it's kind of like you're getting treatment at the same time.
Wow.
And a lot of these sound kind of scary, but it really is just a 20-minute nap and you wake up and they give you your results. And just having, that peace of mind and knowing that that's being checked. So colorectal cancer screening actually reduces the risk of mortality from colorectal cancer by about up to 68%, which is a huge number. Yeah. Some of the other cancers that we screen for would be lung cancer, and those are typically in people who have a pretty significant history of smoking, and that would be with a CT scan of the chest. Pap smears, so women ages 21 and older, to do those kind of periodic pap smears, make sure there's no cervical cancer. Again, that has reduced mortality of cervical cancer by about 50%. And lastly, other cancers that we look at would be in older men, prostate cancer, which would be a blood test, and then skin cancer. Now I know that it's the middle of summer, we all want to go outside, so just a reminder to all check our skin, look for any new lesions, any moles that are changing in color or shape or size or anything like that, and make sure that we're letting our primary doctor know about that.
That is incredible. Now, do guidelines for screening vary, and how so?
Yeah, so it's not really a one size fits all, and the biggest thing is really risk factors, what risk factors the person possesses. So by that we mean what puts them at higher risk than another average person, and that would be things like smoking history for lung cancer, and then family history. So knowing your family history, which relatives got cancer at what age, will mean that you might need to get screening a whole lot earlier than someone else.
All right, and so those are really important. Now, what are the steps that someone can take if they want to get screened? Maybe they notice something, or maybe it's just that time, that age limit of that 40, 45, they're ready to get screened. What does that look like?
Yeah, so I'd say the first step would be to call your mom to find out exactly what your family history is, to find out what family members had cancer, how old they were, and how advanced it was. And then to go ahead and make an appointment to see your primary care doctor. At this stage, you can discuss with them all the your risk factors and what recommendations are for your age. And so then they will schedule, or they will find a facility that can do either the scan or the test or the procedure that you might need done for that. So for example, Piedmont Macon, they have a great mammogram screening program. So they would refer you to that facility. At that point, then it would come to getting the results, and everyone wants it to be negative, which most of the time is what we're kind of expecting, and then it's just reassurance and we can go on with the next interval of screening. But if it is positive, at that time you'll get a care team that will come around you and really try to show you what the treatment options are.
And that really is incredible. Now, what advice do you give someone who is hesitant or afraid of getting screened? Maybe they're just nervous. What do you tell them?
Yeah, firstly, it's totally normal to be afraid. It's totally normal to be apprehensive about getting these tests done because no one wants to hear the possibility that they might have cancer. But I think the biggest thing is that we're not looking for bad news here. What we're really wanting to do is try and stay as healthy as possible for as long as possible. And screening is a gift that we give to not only ourselves, but to our family and our friends as well. The gift of being able to be healthy for as long as possible, to be around, to enjoy moments in life with the family. And really it is worth it to get our screening done, to make sure that it's up to date.
All right, so get those screenings done. To find out more about this, head on over to our website, 41NBC.com.